Before we start tonight's forum, I would like to take this opportunity to introduce our honorable guest speakers. Our first speaker for the night. He is an academic, researcher, and expert in the field of life and death. Graduated with a PhD, he did his postgraduate studies in the Religion Department, Temple University in Philadelphia, USA. Author of many books and journals in his area of expertise, he is the professor in the Department of Life and Death Studies in Nanhua University. Amongst various appointments that he is holding currently, he is also the Dean of Buddhist College in Fo-Guang University, Director for Guanshan Foundation for Buddhist Culture and Education, Managing Director of Taiwan Life Education Association, just to name a few. Let's put our hands together to give a warm welcome, Venerable Hui Kai. Our second speaker for tonight, he is the Senior Associate Director and Secretary of NUS Institutional Review Board. He is also appointed as Human Protections Administrator of the National University of Singapore. Our speaker is a Singapore-registered pharmacist with a Master in Business Administration and Legal Training. He is currently pursuing his PhD in Biomedical Ethics with the NUS Center of Biomedical Ethics. He is also an active member in various public, medical, and educational institution ethics committees. As an accomplished speaker, he has also delivered more than 20 public lectures on palliative care, death, and dying internationally. Let's put our hands together to welcome Mr. Robin Chan. Our third speaker of the night graduated from National University of Singapore Medical School in 1993. He is currently serving as the Assistant Director of Taos Foundation Hua Mei Mobile Clinic. His responsibilities include community-based elderly primary health care and home care service for the homebound elderly. His professional interests span across many folds in the area of elderly ill treatment, palliative care, and dementia care. Apart from his service in Taos Foundation, he also served as a consultant in many community and government agencies, such as Agency for Integrated Care, Elder Protection Team, REACH Policy Study Work Group, just to name a few. He is also currently the Secretary of Home Health Care Association and the Chairman of Kakavela Meditation Center. Also, please put our hands to welcome Dr. Ng Wai Chong. Last but not least, let me introduce to everyone the moderator for tonight's forum. He is an accomplished registered nurse with a master's degree in health science education. His area of expertise in the field of critical care and trauma critical nursing. Currently, he is serving in the National Heart Center, Singapore as an Assistant Director managing the training and developing program for hospital nurses and healthcare support workers. Let's welcome Mr. Jonathan Sim.
And good evening, distinguished speaker, and a warm welcome to everybody. Thank you for taking the time to be present in this forum. The theme for tonight is one which closely related to my vocations as a nurse. However, we know that many of us may view it as very sensitive. Some of us may not be very comfortable to talk about it. The theme is life and death. We are very indeed honored and privileged to have three distinguished speakers to share their expertise on this matter. Again, let us put our hand together and give them a warm applause. Following are the different topics that we'll be sharing, starting with how to face death, how to accept death, and how to care for the dying, as well as the caregiver. Lastly, how to let go. We shall begin the forum by embarking the topic of death as a natural part of life. We tend to trivialize issues related to death and dying, and sometimes even we avoid thinking about it. I would like to share with you my personal encounter in the hospital. As a nurse in the hospital, when we are on duty, most of us would not like to talk about death or dying. Not only that, even whatever we eat, also we are very conscious. To let you know, nurses don't eat pao, no? During their duty. Do you know why? Because pao representing patients will die, and then they have to da pao. On the other hand, they are actually okay with mian pao. Do you know why? It sounds like Hokkien words, huh? Mian pao. Many of us are fear of death, usually because we are ignorant about it. And what exactly death is? I would like to pose these questions to our distinguished speakers to enlighten us on the meaning of death, how to reduce people's fear towards death, and can we find any meaning or inspiration behind death? Speaker, please. Maybe we invite Hui Kai Fa Shi to give us the enlightening.
Thank you. It's very difficult to give a universal definition or concept about the meaning of death. But one, I want to quote from Steve Jobs. When he was invited to give a lecture in 2005 in the Stanford University, the commencement, and Steve Jobs talked about his life and his love of his work and about his thinking about death. And he said, death is very likely the single best invention of life. That's what Steve Jobs said. But I think he was a little bit conservative. From Buddhist point of view, not only death is the best invention of life, but birth, aging, old age, and even illness, sickness, all of them are the best invention of life. So you may wonder. And Steve Jobs also said nobody wanted to die. Even those who wanted to go to heaven don't want to die to get there. And I can assure you, you don't have to die to go to heaven. You can live to go to heaven. But the first thing is that you have to live well and die well. So death is not exist. It does not exist from a real meaning. Our Steve Jobs, he is a very, very, very great inventor and a designer. So I think from his life, he sensed something about life and death. So he said, life, death are very likely the best, single best invention of life. Why? Because without death, the life itself may go into a situation stuck, because we may face the disease, sickness, and some disaster. And if there's no death, then we were stuck in that situation and nobody can help. So that death is a solution. That's from the process, the point of view of the process of life. But that's not enough. To human being, we have more profound meaning to death. That death let us have a chance to take a break and then continue. So death itself is not a problem, but how to die well, how to die with dignity, and how to die peacefully is the real issue. So you don't have to be afraid of death. There is one thing even more horrible than death is you couldn't die. You couldn't die. So the death can help. And Steve Jobs also mentioned one thing is when he was 17 years old, he heard a saying that if you take every day as your last day, then you will live more eagerly, diligently, and you will make the best decision of your life. So death can be served as our motivation, so how we can make the best use of our life. That's my my opinion, observation. Thank you.
Thank you, Hui. Thank you, Hui Kai Fa Shi. Dr. Ng, can you share with us about the meaning of death?
Okay, sorry. Yeah, thank you, Hui Kai Fa Shi. And so perhaps I can share a little bit on the medical perspective. So usually what I do is that for patients of mine who are near the end of life, perhaps there are some signs and symptoms that we could tell, and I'll approach the family to talk about it. And one of the things that I must tell them are the signs of death. How do you tell your parent has passed away? And the most obvious sign to me is the breathing. So you can just observe the heaving of the chest, and once it stops, then give me a call. Then I'll go and certify death. And so I'm talking about the signs and symptoms of death. I'm not defining death per se, but so when I approach a person, and if this person is still, there's no spontaneous respiration, and if you check the pulse and you listen to the heart, there's no heartbeat. So there is no necessary life-sustaining reflexes happening in that body. Okay, then, so to me, that's the most important sign. I mean, in the hospital, they may do an ECG to check a tracing of a flat line, but in a home care, I mean, I practice as a home care doctor, this is not so important. I don't need an ECG to prove that. And then I would go on to check the neurological signs, whether the pupillary reflex is still present. When you shine a torch, whether does it constrict? I mean, all of us, if you shine a light, it will constrict. But for a person who is brain dead, it will not. And then I will also test the Dawes reflex, where I open the eyes, forcibly, and then I turn the head. A normal person, even if he's asleep, you'll find that the eyes will move to keep to the center. But a person who is dead, the eye's position will follow the movement of the head. Then there are other more elaborate tests, like caloric tests, corneal reflex, which I usually don't do. So in home care, I check the heart and the lungs, and then the neurological reflexes. And of course, with the background knowledge of the person's medical condition, then I could do that. But I know that the definition of death technically is really more elaborate than this. Because there are many conditions that may mimic death. For example, overdose of certain medication, like opiates, and severe hypothermia, where they're just fished out from ice cold water. For a moment, they're not breathing and there may not be any pulse rate. So you have to exclude those conditions before you certify a person as being dead. And in Singapore, according to the law, we recognize brain death. I think this is to facilitate organ donation, because you cannot wait for the heart to stop before you diagnose death. And so, because if the heart stops, then the organs may not be harvested easily. So so usually the setting is in the ICU, which perhaps Jonathan would know better. He was an ICU nurse. So, and they rely a lot on testing on the neurological reflexes. So in other words, I cannot define death. I can only describe the signs and symptoms of death. So so that's my answer for you.
Thank you, Dr. Ng. Perhaps now we should ask Mr. Chan, who are actually doing a project on finding out from people what they know by the manifestation of death, right? You want to share with us on that?
Good evening, everybody. I think the idea of death to a lot of people is very different. Some think that when the heart stops beating, you die. But there are people who have a heart stop beating and then you can revive the heart. So if you have a lung problem and the lung stop breathing, but you can put in an artificial lung and then the person can continue to live. So if you base on a situation where an organ fails, then you then always use something else to replace. So now people can think that they don't die anymore in that case. But of course, the legal definition is still about brain dead. So when I went around and asked, what is your concept of death? Nobody seems to know. A lot of people think that they don't even want to talk about it. They were afraid to think about it. So don't even talk about legal definition. You don't even talk about any situation where the symptoms and signs. So that's why people don't even want to listen to the symptoms and signs. So the fact that you are here, you should give yourself a round of applause. But honestly, death is an event. Dying is a process. I think if you are afraid of death, which is only an event, maybe a few seconds, then pop, you go, But the whole process of dying can be very short. Maybe, depending on how the person died, it could be like he met an accident and then he only had 2 hours and then he died. Or there are people who have chronic illnesses that drag to many, many years. So maybe what we should talk about is dying and death. Because death is an event, dying is a process, and this process can be very long. Thank you. Thank you, Speaker, for giving us the wonderful definitions of death. Perhaps now we should look into another issue. So we must be prepared. Yeah? The preparations that I can see here mainly are in two groups. The asset management. Yeah? And the other one is based on medical perspective. How are we going to get ourselves prepared in time to come? Perhaps that we let our speaker share with us, is there any preparations that we should do before the times come? Can you enlighten us on this?
Or talk about preparation, okay? Or so you can look at death and dying from the scientific point of view, or the philosophical point of view, or religious point of view. So I think first we have to understand that our existence the very existence itself has a different level. Different level is the physical level, and the mental, psychological level, and more profoundly is the spiritual level. So from the physical level, that our body, the physical body is the material construction. So everything in this universe has its corresponding limitation of operation. For example, the car you drive has a limitation of operation. Even the whole universe, the Earth itself has its life span. The solar system, the galaxy also. But at the spiritual level, then most of the religion will most of the world religion maintain the belief that the real life, the spiritual life, will continue in different way. So we talk about death is only applied to the physical body, not to the spiritual. But our physical condition may influence our spiritual. So when we're facing the physical illness, disease, and dying, our our mindset disturbed. So the first understanding is to enlarge or upgrade our understanding that there is something beyond our common understanding of the death. There's something, no death applied to it, or spiritual. So 3 years ago, I used a concept called the continuous management of life. From Buddhist point of view, the spiritual life will continue all the time, but our management of life is not continuous. So you have to prepare not only just the death process, the dying process, the death event, but also prepare for the future life. If we can, so I use because I was a math teacher before, so I used the math concept. The life equation, if you only give, if you limited your, the math equation or formula has solution or not, is not the equation itself. It depends on which domain you give to the equation, which number set, the real number, the integer number, rational number, or the complex number, or vector space. If in a very narrow given domain or set, then the equation or solution may appear has no solution. And if you enlarge the domain or the number set, then the solution will have an answer. So if you define the life as only one lifespan, then the life equation will have no answer. If you enlarge not just one life, but 3 life, past, present, and future, then the last equation will have many solutions and will bring you hope. That's for your consideration. Thank you.
Now we have heard about the spiritual preparation. Perhaps we should move on to medical preparations. Medical perspective in preparations as well as legal perspective in preparations. Dr. Ng and Mr. Chan, please.
Okay. Even as a doctor, I can't afford to think only medical. In my work, we take care of people who are aging. And I would like to think that to prepare our death, we might as well think about how we prepare the dying phase. Of course, most of us, we do not know whether we'll drop dead. In that case, there's nothing for you to prepare. But, not exactly nothing for you to prepare. You still have to keep your precepts and practice good spiritual habits. But most of us will age and then will suffer from sickness. So in order to do this well, we have to prepare. How do we age well? So how do you age well? The WHO recommends 3 pillars for successful aging. Active aging. First of all, income security. Okay? The sense of security is very important. You don't have to be very wealthy, but you have to feel secure enough about income, especially if in a society like this when there are no handouts. This is first point. Second point, health and access to health. You have to keep yourself healthy. So you don't smoke, you eat healthily, manage your weight, exercise regularly, vaccinate appropriately, and then perhaps you can avoid disabling diseases like stroke, perhaps dementia, heart disease, osteoporotic fractures, and so on. So you prevent all these disabilities. At least you can age to live quite long without very much disability. Imagine if you have to be lying in bed for 5 years before you die. That's really torture, isn't it? Okay, so health and access to health. Thirdly is participation. So we don't cut ourselves away from the society. We must engage in relationships. So be it in your family or your friends, and engage. If you retire, think of something to do. Perhaps take up another part-time job, or to just actively engage in community, voluntary, or even spiritual practices. So you continue connection with other people. So these are the 3 pillars recommended by WHO for us to age actively until the day we die. So some people think that active aging means a person who is in his 70s and still playing guitar and singing rock song and hang glide. It's not like that. You can be on a wheelchair or even bed-bound in bed, and you can still age actively if you're able to feel a sense of security and you have relative freedom from suffering. For example, your pain is relieved and your family is supportive and you engage in their life. So these 3 pillars, supported by a cultural milieu of inclusive society, that no one is marginalized because of their age. So in other words, it's not just up to us to age well, but it's also whether the society is supportive of aging. So if you age well, then of course, aging is actually dying, isn't it? Aging process is really a dying process. So if you age well, you actually live well until the day comes when you die. And when you die, you feel peaceful, you feel secure, and you feel that you've done what you have to do, and you have no fear about the future, And the rest of it, I would really refer everybody to what Reverend Hui Kai says. Reverend Hui Kai Faster says that as Buddhists, it doesn't end when we die, and the next destination depends on how you live your life. So preparing for our death really is about preparing for the next life, and that the Buddha has already taught how to prepare for the next life. Yeah.
I think everybody here wants to have a good death. Anyone? Good death? Wow. So last year I make a research and asked those people who attended my talk last year, and at the same time I conduct this research on 815 people and asked them, do you want a good death? 100%. Everybody wants a good death. But when I went to ask the question, how do you achieve and prepare for a good death? The interest is in a good death, not active living. So we're not talking in a very different manner. How do you prepare for a good death? Well, majority of the answers comes in this way. You take vitamins, you exercise, you have less stress, you live, you don't work too hard, and or you eat a lot of health food, you eat organic food. So can all this generate and help you prepare for a good death? Maybe, maybe not. But it will definitely make your life a little bit better, but not necessarily so, okay? So then again, the misconception of preparing. Like Hui Kai Fa Si has said that you can prepare mentally, okay? You can prepare medically, and if I'm the lawyer, so I have to tell you how to prepare legally. So how many of you have written a will? Please raise your hand. A will? Okay, if you don't have, when are you going to write your will? So writing a will is preparing to distribute your assets equally. If you don't distribute your assets, and then your family is left with a lot of money, okay? Then what are you supposed to do? They fight over the money, then there's a lot of problem. You may not be able to get a peaceful and good death. People will curse you behind your back. The other thing is the person says, oh, I don't have any money, you know. I only have this body. So when I die, can I give you my body? Even if you do that, you have to tell the person, what are you going to do with that body? He can't make it in the pork chop, you know. You have to decide whether he wants to go for what type of funeral, what sort of rites, and what sort of things that he wants. And that is in accordance to your wish. And that comes in a form of preparing. If you don't want to face death, if you do not accept death, then how could you prepare for death? A good death is a prepared death. You can only prepare. You don't know when it's going to come. It will come, I can guarantee you. Okay? The fact that you are born and everybody dies. But the whole thing lies in the fact with people are not willing to prepare. This evening you came for this class, and I heard that it was raining. If you know it's going to rain, are you going to prepare an umbrella? Right. If you know it's going to rain and you don't prepare an umbrella, then serve you right for getting wet. The same with death. So preparing legally is important, and there are many ways to prepare. So we will discuss this as along we go with this. Thanks.
So friends, we now know a lot of preparation we need to make now, spiritually, medically, as well as legally, right? So with that, sometimes that writing of living will can be quite difficult, right? Yeah, have you think about that? So, to share with you some encounter during the hospital is that sometimes in hospital, I encounter this, family members of the affected person who actually they have living will, like what Mr. Chan has said, that, you know, if you have a lot of money, how are you going to distribute? I think no money is actually the better way, isn't it right? So if you happen to have a lot of money and you make the will at that time, what happened is that the family members get disagreement with the will, and they say that this is not right. Why? Because they might say that during that time the patient is not well, do not have actually a so-called sound mind, mentally is not well. So does it mean to say that, you know, the living will is not valid? So to come into questions, what exactly is sound mind actually in definition, so that we can actually better understanding being sound mind means, you know, in what kind of situations. So perhaps that we would like to ask the three speakers to share with us their expertise related to sound mind. 慧开法师，请。
This is very important. A sound mind. Well, unfortunately, most people are lived overdue. That means lived up, stuck in a situation that is long beyond past his tasting period of life. You understand that? You go to the supermarket, 7-Eleven, or you buy a pack of candy or instant noodle or some foods, and on the pack there will be a expiration day, right? That's called the tasting period. So our life, every individual's life has its own tasting period. And unfortunately, most of us live beyond the tasting period. You understand that? So until, for example, many people suffer the multi-organ failure, right? Or the Alzheimer's disease and the senile dementia, right? If that happens, then it's very difficult to prepare. So I give the advice, don't let that happen. Don't let that happen, because if you fall into that situation, there will be no sound mind. So from Buddhist point of view, the good death, or if you really want to die very well, then you have to know your death beforehand. You can practice. And for example, you vow to go to the Pure Land to be with Amitabha Buddha, the Guanyin Bodhisattva, and the Buddha and the Bodhisattva will give you a notice. So when they are going to receive you to the Pure Land. And so that I respond to Steve Jobs, you don't have to die to go to Pure Land or to go to heaven. You can live to go to Pure Land and to heaven. And so that so the best situation is that you have to preserve your physical energy and the spiritual energy for your future life. That's the best way, I assure you.
Dr. Wu?
Actually, sound mind is a legal definition. So as a doctor, we assess decision-making capacity, so we assess mental capacity. So how do we do that? First of all, we need to recognize that the different states of mental deterioration, but it doesn't mean they cannot make decisions for something, they cannot make decisions for other things. So for example, you can have somebody with Alzheimer's disease, they cannot make decisions whether they should invest in this particular stock or that particular property, but they can make decisions with regards to whether I want to have my lunch now or should I have my lunch later. Okay, so we don't just based on one assessment and disregard the fact that the person can still make decisions for different other situations. So how do we make the assessment? First of all, we need to find out whether there's any underlying condition that renders a person the possibility of losing the capacity to make decision. So it could be organic brain diseases like Alzheimer's disease, or it could be just a brain tumor affecting certain parts of the brain, multiple stroke disease, or acute brain diseases, I mean like encephalopathy from infection, from severe generalized infection. Or it could be a psychosis, like for example schizophrenia, or it could be just mental deficiency. People are born without that mental capacity to make decisions. So we need to know whether they have an underlying condition that might influence a person's decision-making capacity. And then how do we test for it? We test whether the person can understand the situations you're giving to them to make the decision about. And then you have to see whether they are able to retain the information. That means have good memory enough to retain information and weigh the information, consider, and then tell you their decisions. So if they can't do any of this, like they cannot understand you. For example, they have got severe aphasia, certain kind of stroke affecting the left side of the brain. They can't understand your language. So they may not have dementia, but they cannot understand you. Okay? Or they cannot retain the information long enough, for example, in dementia. Or they cannot weigh the information. Also in dementia, they do not have executive function to weigh information. And lastly, they cannot speak to you. Perhaps it's because they have got aphasia, a stroke, affecting the ability to convey their message. Or if they are comatose, then they totally can't talk to you about this. So based on that, usually I further like to test. When they tell me a decision, I like to ask them for the reasons. If they can give me a reason, for example, I ask a person with dementia, I frequently do this. Would you like the doctor to insert a tube into your nose if one day you cannot swallow, and so that you can be given milk feeds or water? And if they tell me no, I do not want that, I'll ask them why. If they can tell me things like, it's very painful, it's very uncomfortable, I will accept that they have decision-making capacity, even though they have dementia, because they're able to give you a reason which is logical. But if they tell you they do not want that because, recently I have a similar situation. They do not want that, I can't remember what his reason is, but it's really all out, like, I want to go home, something like that. It's not logical as a reason to why he doesn't want to put nasogastric tube. Then I cannot take his answer as valid. Okay, so this is how we make decision. The doctor make assessment whether the person has mental capacity. So if they do not have mental capacity on certain things, if next time when there's another decision is required, like whether they want to go to a nursing home or not, you still have to ask them again and to check whether they have the mental capacity to decide whether they can go to the nursing home or not. So back to the question about soundness of mind. So usually that is the court to decide. So perhaps Robin could share with us.
Soundness of mind is a legal definition that nobody seems to understand, because it's very subjective. You think that this person is mentally sound, but the other person can think, siao, this person is crazy. So where do you draw that line? In the case of a legal situation, we seek the help of a psychiatrist. Normally, if one psychiatrist is not enough, you seek the opinion of 3 psychiatrists. Why 3? Because out of the 3, if 2 say yes, 1 say no, the majority wins. So at the end of the day, it's still very subjective. But I would like to explain that whether it's sound mind or not, there are a legal way to also avoid this situation. That is to prepare in advance. I explained that you can prepare a last will to handle your assets. What is a last will? A last will is only executed when a person is dead. That means if death happens, like I said, death is an event. After death, then you can decide on the assets. That is called a last will. There's also another document called the living will. A living will could be an advanced medical directive where you already, when you are in competent state, hopefully now, you can state down whatever you want. And if you say, I don't know how to decide now, so what am I supposed to do? Maybe perhaps there's another way, and that is to appoint somebody to execute for you in the event that you are not able to have a sound mind. What does that mean? That means you give that right of decision to a person that you trust. Perhaps the husband can trust the wife can trust the husband, if they don't end up fighting every day. Or you can trust your best friend, or you can trust your relative, or your brother or sister, who has no conflict of interest, who knows what you want, who knows exactly what you do. And you do a lasting power of attorney, an LPA. And that you could do it like a letter of authorization, authorizing this person to take care of all your welfare, not only in health, but also in money. Now, I give you an example. If the person has been proven not to be of sound mind, did you know that even if you have money in the bank, you can't go and get your money? If you are not in a sound mind, okay? If you cannot get, if you go to the cashier, I give you an example. Recently, there's a very well-known case. An elderly lady who can walk, not on wheelchair, she's being held by her goddaughter to the bank to withdraw money. And he says, then everything was spoken by the goddaughter. And when they asked this elderly lady, Auntie, you want to draw money? Then she say, Auntie, how much money do you want to draw? You know what she said? So after a few the cashier realized that this person may not be of a sound mind. And the bank has a right not to give a single cent. Why? The bank thinks that he is protecting your rights, your assets, in case this person is a con woman trying to cheat your money, right? But you may need the money to treat your If you need that money to treat your medical condition and your money got stuck in the bank, what are you going to do? And if you go and see a psychiatrist and the psychiatrist say that you are no longer of a sound mind and you don't have a lasting power of attorney and your will is only after you die, it's a horrible situation. So you can sue the bank, you can sue whatever, the bank wins, right? OCBC has won the case, UOB has won the case in Singapore. So you have to prepare. Besides the last will, you have to make a living will. That means you are alive, but not of a sound mind. And this living will could be in the form of, if it is in the medical, then it's advanced medical directive. It could also be an advanced care directive, or you can just produce a letter which is called lasting power of attorney. You can go to Google and Google about Office of Public Guardian in Singapore, or just type the word living will Singapore. Google is the best way you can get information in Singapore.